Today we're going to talk about cannabis oil, cannabis receptors in the brain, using cannabis medicinally. Also, it's known as hash, weed, pot, grass. Sharon Price is with us today. She's an absolute pioneer in the field of research. She's helped so many people with cancer and epilepsy and various other conditions. And also quite a fighter for the rights of being able to use cannabis in South Africa. Welcome, Sharon.
Thank you.
I met Sharon in 2013 when my fiance was diagnosed with a very large malignant brain tumor, and she's traveled the journey with me, and we share a similar story. I believe that you started your journey with your sister and a brain tumor.
Absolutely, yeah. It was a 3-year journey. Very difficult journey for the family and everybody, and unfortunately we lost Carol. She was a young girl, 34 years old. During this time I was constantly researching and looking at how we could help her, looking at dietary information, just looking at anything that actually could give her some relief. We weren't even thinking cure at that stage. We were just thinking, just so that she could have some quality of life during the treatments.
So she was having chemo, surgery, radiation?
Constant. And over 3 years, she was not even herself. It was very quick. Within about 7 months, she didn't look like herself anymore. Obviously, the treatments were just too aggressive for her.
Mm-hmm.
Literally 3 months after Carol passed, I was on the internet and I saw the Rick Simpson story. This really made me furious. I just couldn't believe that somebody could say that cannabis cured cancer. Didn't take it seriously. But I went off to see a friend of mine who happens to be a really knowledgeable scientist. I spoke to him about this thing and I said, really,
Can you believe this rubbish?
Yeah. Can you believe that these people can even say this? Can you believe that they're giving people a false sense of hope with the state of cancer in this country and the world at the moment? It's just, everybody just clings on to any hope they can. Long story short, he severely reprimanded me. He said, look, ma'am, you go home and study the endocannabinoid system and then come back and we can have an intelligent conversation.
Because you had no idea that we all have our own cannabinoid receptors.
Absolutely no idea. This shocked me when I got home. I started compulsively studying. I then looked at Dr. Raphael Mechoulam, who was the founder of the cannabinoid system. At that stage, this was 9 years ago, there were 63 cannabinoids in the plant and 63 endocannabinoids in our body naturally before we're born. This is
of all mammals?
Absolutely. This has been going on since the 60s. We've had a lot of research done on cannabis on all levels.
Tell me about your experience with your first syringe, and if I can just explain that for people who don't know about the oil that's in the syringe. In actual fact, can you explain it? Because you can do it so much better than I can, about the difference between the oil and the difference between the ratios CBD and THC in the oil, and how that applies to different medical conditions. But let's start with your first syringe.
Okay, my first syringe was quite a journey. It ended up costing me a huge amount of money. I did development. I worked with a university. I worked with a scientist. We tried all kinds of different products, eventually settled on a certain standard, which is now, we've completely standardized the process. There are certain genetics...
Sorry, the extraction process.
The extraction process and the genetic process. The most important thing here is, well, everything's important, but the genetics are the most important thing.
Please tell us about that.
You have to work within the INCB have certain standards, and those standards, the things that qualify a medical plant, is anything between 17 and 20% THC. Now I know there's a lot of talk about CBDs and CBDs being the way to go, but you cannot access CBDs without THC unless the plant is genetically grown. But in a natural situation, the first component that you want to, in extracting, that you want to activate is the THC. The THC then is a key to the CBDs.
Mm-hmm. So people think a cannabis plant is a cannabis plant is a cannabis plant, but it's not.
Not at all. And this is the problem that we're having because of prohibition at the moment. Everybody, a lot of people are, they're coming from a good place, they just want to help, but they're using any plant, they're using the long extracting things. I'm not saying everybody.
And I think that's what worries me, why I would advocate for legalization of medicinal cannabis oil, because you need to protect the cancer patients from acquiring it illegally and then just making the whole cancer situation worse.
Yeah, Delene, it's not a magic bullet. Cannabis is not this big magic bullet you just casually take cannabis, have a Boerewors roll and a brandy and coke at the same time. It's not going to work. We work with protocols. We work with diet protocols. We work with supplementing protocols. So a cancer patient walks away with a large package, not just a cannabis package. And this is where the problems come in. The guys, for example, prostate and breast cancer. Both are often estrogen-driven cancers. You cannot use just any plant for this. There you want to be working with a 1-to-1 ratio.
You mean CBD to THC?
Yes, I do. So you have certain genetics. Let's say one of these genetics is called Cbd nodal. Cbd nodal has a 10 THC, 10 CBD. It's bred to work like this. It doesn't drive the estrogen. So this is where mistakes are happening, and this is where our concern is about prohibition, making it easy for a desperate person to go and buy from anybody, and everybody is treating terminal people now. Mm-hmm. We've got this entourage of CBDs that we spoke about earlier on. So you're looking at a complex plant with over 500 medicinal components actually when you break it down. The moment you light that joint, you kill the whole lot and you're only sitting with THC. So there are medicinal certain things. For example, Parkinson's. When people smoke with Parkinson's, the shakes disappear very quickly, mostly. I prefer to work with the oil with sick people because we want to work with cannabinoids. Smoking a joint, you're working with only THC. It's not going to cure cancer.
Before we talk about the different types of conditions, medical conditions, and how you use cannabis or cannabinoids, talk to me about the different ways of administering it. You've got tinctures, you can do juicing with the plant, you can extract oil in different ratios. Talk a little bit about that.
Well, for me, my favorite, and hopefully shortly the Concord will actually, a constitutional court will actually allow us to grow at home. My favorite and best way is to grow this in your garden. Its rightful place is right between the parsley and the basil.
Without spraying anything.
Without spraying, of course. No GMO, because this is coming. Cannabis and GMO is on its way. No.
You're talking about the whole Monsanto thing now.
Yes,
and
not only
touch on as well.
Not only that, a very controversial thing is we've got this new Canadian company coming in shortly, and they're using nanotechnology, right, which is illegal in Canada. But they want to come sell it to us in South Africa. And guess what? All the medicine that they're going to make only goes to South Africans.
Sure.
Why should we have something that's illegal in the country that they're coming from? Why should we not rather just supply all the medicine that comes from that particular grow to Canada?
Yeah.
There are very different ways to administer cannabis for different diseases. So we work with tinctures, which are quick. They react within 13 seconds. We know this. We've put people onto EEGs and administered.
Please explain EEGs for the viewers.
Okay, it's basically a machine that measures the brain pattern. Where we've been very fortunate in that we've been allowed to put patients on the EEG and then dose them. We've had incredible things happen. Within 13 seconds, you see a brain pattern change.
So who's the we?
Well, it's a very difficult thing to say right now because, of course, doctors don't want to be implicated. But I have to tell you that there are thousands of doctors in South Africa today prescribing cannabis oil. They're seeing the results. Their patients have come to them.
And you've trained many of them.
Many medical doctors have been trained.
And you work with universities. We're not going to go into specifics.
Absolutely.
So some people do better on tinctures than they do on the oil. And is that also, what does that depend on?
It depends on what the disease is. So if somebody comes with Parkinson's is very much a neurological disease related to inflammation in the stomach. So immediately we work with something called THCA, which has no THC in it. It's like the so-called CBD oils, but much stronger. This works with the brain. So tinctures are far better. We do work with oil, which we take in capsules that go straight to the stomach, so we work in both ways.
With the syringe, what you gave Marco was just on the tongue. It's like a rice grain dosage measurements.
Absolutely. It's a tiny, tiny dose. But
starting small and building up.
Yes, and very quickly, 5 weeks, a person's body builds tolerance.
And you've got to increase the dosage?
Absolutely. We work with saturation, but we don't want the patient out of it while they're busy.
That's the other thing that you do is when you prescribe it or supply it, right word, then, somebody gets enthusiastic and they cannot imagine that a small little rice grain could actually do anything. And they take like a bullet and they're knocked. And then it's often when their spouse needs to call in and say, talk the patient down.
Yes.
Can you just talk a little bit about, I've asked you so many questions, I'm sorry, I'm going to keep quiet now, I'm just going to let you talk.
Okay. With an overdose, and this is a thing that happens, but remember there's no overdose that kills you. I can't remember the figures, but to actually die by cannabis, you've got to smoke 20 kilos in 10 minutes or something. Kind of impossible. We have had people that have taken too much. It's often the smokers. I can see when I'm busy taking this tiny, tiny amount, they think, oh, what does she know? I smoke cannabis, And they'll go home. What it does immediately causes hypertension. The person stops breathing properly. They start breathing in a really shallow manner. And this just almost looks like a heart attack. Remember, nobody's ever died from cannabis, though. Mm-hmm. So we make sure a lot of guidance is needed for a person that's ill. We make sure that they don't. So we really have this happening. And even in cases where we've purposely had somebody take a large amount of the oil, they've slept it off. Mm-hmm. They got a biggest fright of their life. It's not fun. It's not a recreational thing that you can do for fun.
So they can go into paranoia.
Absolutely. This is why you must work with a practitioner. You must work with a medical doctor or a practitioner.
That. I love hearing that because the viewers might think that, hey, I've just got a woman here that's growing and selling cannabis oil and going for it. It's so far from it. You're probably one of the most responsible complementary medicine suppliers that I have ever met in any shape or form.
Thank you.
Really. You have such credibility.
Thank you so much.
When you want to prevent cancer, can you grow cannabis oil underground in your home, in a garden that's not sprayed, and just cut the plant and juice it?
Absolutely. The benefits from juicing it are phenomenal. It is a preventative. It will control your blood pressure. You won't believe how quickly people with full-blown diabetes, 5-6 weeks. We've had patients, one particular guy, that was on 20,000 rands worth of medicine. He was lying down to die. He had blue bags from injecting insulin on his stomach and everything. We literally turned that man around. That it's been about 4 years, but within 5 weeks we had him up.
What did you use? The oil, the tincture, a combination?
In his case, we used a THCA tincture in the morning, so it's something that he could go to work with and still do his thing.
Just explain the difference so people understand.
Well, it's a CBD only tincture that works neurologically,
Which
so
is
just
your
to
THCA.
wake him up. Correct.
Right.
I often use that because of the THC being really strong, and you can feel a little bit like you just feel as if you're taking a sleeping tablet in the morning. So we then use the THC. In this guy's case, we used a cream because the damage on his stomach was really bad.
Did you use coconut oil? What did you use
I
as
used
base?
a cannabis cream. I used coconut as base, but I have 1 or 2 other things in my product that makes quite a difference, gets it into the body.
The DMSO, right.
Particularly DMSO,
Right.
which is an amazing product. So it takes it from the surface right into the organ.
So you put this underneath?
He used this on all areas, and then whenever if he slept funny or whatever, I get people to use it any area where there's pain, there's inflammation.
Sure.
And it's an anti-inflammatory, it's an analgesic, the cream. He used that, and then he used the oil at night. Once he'd overcome everything, it took about, he'd kind of saturated his body, filled the fat cells in his body with the cannabis oil over a period of about a year. He then hardly ever uses it. Now and then the body doesn't need it so much because it's already in there.
So he's reduced the insulin.
He stopped it. In about 3 months he was off insulin and 20,000 rands worth of other medicines. Completely off
Because
every
he must have been completely insulin toxic. We talked about the juicing, we've talked about the tinctures and the oil. But I know that it's also used for breast cancer patients. How do you apply that, and what is in there, and do you also give them 2 different forms of cream?
We do. It depends whether the breast cancer is estrogen driven, which often it is estrogen driven. So there we would work with this particular 1-to-1 ratio, and we would then make certain creams, and depending on what the physical state of the patient is, sometimes we will prescribe magnesium with it, or we will prescribe 1 or 2 other things. Remember, at the end of the day, I'm actually a herbalist. That's what one of my qualifications are. So they would get a lot of other plants, a lot of things to control for example, the hormone thing we control with broccoli extracts.
You make that yourself?
I have a group of doctors. One supplies me with this, another supplies me a lot.
Right.
A lot of the stuff.
So it's not over the counter that you can just go. I mean, I know there's broccoli extract on over the counter, but it's not that you can now hear this and go and get your own.
No. What you can do is eat tablespoons of broccoli sprouts, which are,
live food.
Live food, and not only that, broccoli is really incredible for breast cancer, all cancers, but a little tablespoon of broccoli sprouts is equivalent to a huge punnet of broccoli like this. So these are things we work with the patients with.
So it's a comprehensive approach. Can someone get high from using your cream during breast cancer treatment?
Not at all. It's used topically, so it goes through the skin and through the kidney and liver before it even gets to the brain. So you're using such a small amount. No. We avoid the high at all levels, Deneen, because the patient is already arriving with a crisis in their life, whatever it is. So the last thing you want to do while you're trying to deal with cancer or Parkinson's or MS or anything is to be falling around the place giggling.
Sure. But then on a more serious note with Marco, I mean, just for the record, he had stage 4 glioblastoma multiforme and an astrocytoma.
Yeah.
So with him, he needed to have a 95% THC oil.
Yeah.
And he took it at night, and within an hour he was high.
Yeah.
And he laughed a lot. He loved it. He ate much better. His appetite was returned. He slept like a baby, which he wasn't able to do for years.
Immediately from the first night.
But also in the morning, he was still groggy and high, and he would climb out of bed and sit there giggling, looking at his shoes, thinking he should probably put them on now. So it was funny. But the point I'm making is he needed to be completely saturated for a period of 3 months.
Yes.
What is the interaction between the high THC oil and chemotherapy or radiation, the typical approach an oncologist would take?
Okay. So much research has been done with regards to that, and it's now absolutely been proved that cannabis actually improves chemo.
So you use it together?
Absolutely, 100%. And the oncologists, most oncologists are understanding that there's no damage over there. And they're actually saying, when patients ask, they're saying, oh yeah, you can use it, we're not worried about it. It's going to help with the side effects. It certainly does. What it does is immediately stops nausea.
That's the Sativex drug that is used in the States for nausea, but that's
Yes.
a very small amount of cannabis.
There are a lot of medicines that are being made from cannabis now. We work very much like California does. We're completely all about the full plant extraction. We're also all about the entourage effect. What happens with products like Sativex and Marinol, they're part plant. So Sativex and Marinol have no more than 2 cannabinoids. In fact, one of them only have 1 cannabinoid. Ironically, THC, the big controversial
Right.
THC.
But it's a prescribed drug.
It is a prescribed drug, but you want to start looking for side effects then. For example, I don't really want to go off too much about other people's products, but please be careful when you take part plants. Some of the side effects are it would affect a fetus if you're pregnant. It would affect a man's sperm count. It's an intricate plant, like our body is intricate.
And you're talking about drugs now.
I'm talking about
Side
part
effects
plant
of part plant
extraction.
drugs, synthetic copies of the THC.
Part plant cannabis drugs. And Sativex and Marinol are not synthetic copies because they can't actually copy this. They are part extracted things. So whereas a full extraction plant, you're looking at over 500 medicinal components.
And that's what you supply oncologists.
That's, as far as I'm concerned, it's the only way to go. Why we go right back to, we're sitting now with 118 cannabinoids in the plant, 118 endocannabinoids in the body. Why on earth would I want to take all of them out and leave one in?
Sure.
Because
but it's all about the whole plant extract. If you look at herbology, as you'd know,
absolutely.
it's the whole plant extract that makes the difference.
It's the entourage effect.
Yeah.
So really, as far as I'm concerned, a full plant extract immediately gives a person the sleeping tablet. Let's talk about the high THC oil. It gives them a sleeping tablet, it gives them an anti-inflammatory, it's an analgesic, it calms them down. Each cannabinoid has a different effect. I don't see why a patient shouldn't get the full extract and all the effects. This entourage effect has a massive effect on the body.
That's how nature made plants.
Yes.
The roots, the stem, the flowers, the leaves, the seeds.
Absolutely.
You know, it's meant to be all used. Where are we legally now in South Africa?
Well, at the moment we are waiting for the plant to be legalized. Unfortunately, they've really been dragging it out. We're way behind the rest of the world.
California was just legalized recently.
On all levels.
Yeah.
And so many places are. Hawaii has been doing amazing things as well. All over the world. We know that it's legalized in so many places. South Africa we didn't really look at this early enough. So suddenly the guys like the MCC are frantically trying to find out what's going on.
But they were approached, when the MP Ambrosini stood up in Parliament and he talked about his cancer and his use of cannabis. Then there was the interview with Carl Albrecht from Cancer. And he said that they would look at it when it's a registered medicine. And as both of us, I don't think we would appreciate anyone and everyone just going out and smoking, because that's not medicinal.
No.
So I mean, they've known about it for many years now. But aren't we looking at a potential hijacking situation here, where the Medicine Control Council wants pharmaceutical companies to extract oils and sell them and only them?
I don't think the people of South Africa will allow that. Unfortunately, here we're talking about a situation where people are in a corner. It's a do or die situation, and they watch somebody with whatever disease take this tiny little piece and go and sleep and get the munchies in the morning. Those people are not going to allow this to. For example, my mom, 74-year-old woman, pancreatic cancer, 8 months pancreatic cancer clear, no cancer. Worked with 7 of the top best doctors in this country. No chemo, no radiation, no pancreatic cancer.
What did you give her?
My mom took large amounts of the high
THC oil.
THC oil. She was on a strict diet. She had a huge amount of supplements. But this 80-year-old lady, is never going to fall for a part plant. So, Janine, what we're pushing for is that this plant is grown in the garden and eaten raw.
So for home use?
Yeah.
For recreational
There's
use,
no
if you
harm.
want in your own home, for juicing.
Yes.
And then if you want to supply someone that can make the extraction, or if you know how to extract yourself.
Talene, I think that question is going to be answered shortly by the Concord or Constitutional Court. Within the next 3 weeks, hopefully, we're going to get an outcome from Judge Davies's judgment in High Court. And hopefully this is going to be that we may grow in our garden, in the privacy of our home, smoke and grow. I'm then going to be very excited to share knowledge with people on how to grow, share genetics with them, how to grow the correct plant at home, how to make sure that it is grown organic. This plant loves chemicals. Very quickly it'll absorb anything, any runoff from fertilizers or chemicals. So that a patient can actually take the flower or the leaves and put it into a smoothie. Children can have it. It can be used across the board, and it's a great preventative for a lot of diseases.
But how would you do this? What platform would you use?
Well, at the moment, we've just recently, a small group of people nationally have put together an association. It's the Cannabis Industry for Development Research. It's a national association, although a small group of us represent Western Cape.
So you'll probably have like a website.
We have a website going up very soon. We are very happy to be able to train people. We can get a lot of the information through. We have already been acknowledged by MCC.
Right.
In fact, they've already called on the Johannesburg branch. So we're waiting to communicate with them. And as soon as this happens, we're going to make sure that the man on the street in South Africa has the proper knowledge. So that before you purchase oil, you know what to ask.
I was going to ask exactly that question, because there's a difference in the method of extraction. Just touch on ethanol for me really quickly, and what the dangers are if not used.
Well, ethanol, the particular alcohol that a lot of the better oil makers are using, is a 99.9 food grade ethanol. So the guys that walk around and tell you that they're using medical alcohol, there's no such thing. That name is in no medical book. So many other products are being used because they're cheap. So for example, 2.5 liters of food grade ethanol cost well over 700 rand, yet 25 liters of isopropyl, you're looking at about 250 rand. So the guys are going into hardwares, buying butenes, isopropyl alcohols, acetone, benzene. We've even had oil tested recently that had benzene in it. You know, it's economy is very tight in this country at the moment. Everybody's tight on money, so every dealer is making cannabis medicine.
What would you expect to pay for a 10 ml syringe of cannabis oil if it's made with ethanol?
If it's made with the proper genetics, which...
Well, regardless, because they can charge what they want and saying it's a higher price because they've used ethanol when they haven't, and they just make a bigger margin. But what would you pay for?
On average, the better oils are selling for about 600 rand a ml.
Right.
That's what the average price is. It varies. Other people are selling it for 400, 600, 800. It varies. Just stay away from cheap oils.
So just to summarize, if you have a family member or you yourself have just been diagnosed or recently, or you are a cancer sufferer, The recommendation you would give is go to your medical doctor, and if he is against or she is against it, go to another medical doctor until you find someone that will work with you, that will work with, or you find someone in oncology that will work with cannabis. And so it's not that you need to go do the research and you need to ask a supplier for a 70% THC 30% CBD ratio oil, or I want a tincture, or it's nice to empower yourself, but I mean, it's not, you're not your own best doctor.
No, you want a practitioner. Even anybody that gets cancer is overwhelmed, mostly overwhelmed. So you want somebody to guide you, and certainly when it comes to cannabis, it's such a controversial thing. People are trained now. We can refer you to a trained medical doctor or trained medical oncologist. Integrative oncologists are big now. Many of the oncologists are going to study further because, they're sitting with not an incredibly good success rate. It's like ridiculous. I don't even know. It's between 2.5% and 5% success rate for something that's hectic at the moment.
Sure.
So people are frightened, they're scared, and they kind of, even the oncologist is overwhelmed. And this is why we're finding the oncologists are now referring. Not because they wanted to in the first place, because they've watched patients come through and actually have these incredible results and are now realizing it's not harming the patient. It's certainly making a big difference.
And you can use it in combination with the chemotherapy.
Brilliant
drugs.
with
That
chemo.
is a choice that you wish to
Absolutely.
make. I want to touch on teenagers and the smoking of weed and the dangers in the developing mind.
We certainly don't want to see cannabis just freely used by teenagers during school years. It does have a negative effect on the brain, on a developing brain.
You're talking about smoking weed.
I'm talking about smoking cannabis. It's
and
a very
and
different
taking
thing.
oil?
Different thing.
Okay.
We have a lot of children, especially two particular universities, that use a lot of the THCA tinctures during exam times.
Even without a medical condition, you're talking
Without
just
a
for,
medical,
just
just
for
for
anxiety
focusing,
and concentration.
Concentration. It's way better than a lot of the stuff the kids are using now. So it's a product that is being used literally for exams by a lot of the kids.
But you're cautioning against teenagers smoking weed
Not
because
smoking.
of the effect on the developing brain. We just need to put that down.
Absolutely, very clearly, because you're sitting with one cannabinoid. So the moment you light that joint, you burn 499 components. This creates an imbalance. This is what we call green fever often. So as far as I'm concerned, smoking, there's a small place for it as a medicine. It stops people shaking if they have Parkinson's. It stops Tourette's in its track in seconds. And sometimes it has incredible neurological pain relief. They're different, with the different products they react differently. So I would certainly much rather be using a full extraction plant because of the entourage effect and because there's, it's not this huge imbalance with THC only.
But it just takes longer.
It'll take 2 hours for the oil to kick in.
So for Tourette's, if you're going into...
You want it quick.
You want it quick. That's when you would not advise, but that's when you would use it as a joint.
I still would prefer treating that patient with tinctures.
Okay.
But in some cases, we have had places where we cannot get pain relief. And you will not believe it. The most extreme case of colon cancer was the first time where we realized that the sweetest Muslim lady that never smoked in her life, and she smoked on a vape machine. So we work with a machine that controls the temperature, and it stops the plant from being heated over 100 degrees. This way she was able to get the cannabinoids, the pain was gone in seconds. So there are cases, there are places where, but 99% of the time, the plant is better than smoking.
I think we also just need to make a point that every person is unique. They're an individual, and they need to be seen by a practitioner, and they need to be prescribed, and they need support, and they need the family members on board. They need to know financially if they can pull through with the whole thing. There's a body of thought out there that if you take cannabis oil, even medicinally during cancer, especially as a youngster, adolescent, that you will end up with schizophrenia. Because so many of the baby boomers smoked weed and ended up with schizophrenia.
That's not true at all.
Why are you laughing?
Because it's such a ridiculous question. We work with a lot of people with schizophrenia.
Okay.
It's the type of medicine that you use when it comes to schizophrenia. So schizophrenia we don't treat with high THC plants. Yes, it will trigger schizophrenia, but only if it's there. So latent schizophrenia can be triggered by a high THC plant. Again, work with a proper doctor or practitioner, and he's not going to take a schizophrenic person and put them on high THC that's going to trigger it.
So there is a risk, though. There is a percentage.
There is a risk with the wrong product prescribed. It can, but only, again, I must repeat, it can trigger schizophrenia where it's already there, where we have a latent schizophrenic potential.
That's
cannabis
genetic.
can trigger it. Yes. Mm-hmm. But it's not going to create schizophrenia. You cannot create schizophrenia with a plant. So it is
concerning then. I have to say that. So if I am, for example, have a genetic marker for schizophrenia and I develop cancer and I start taking cannabis oil, there is a risk.
Yes, but again, let's go back to practitioners, doctors and dealers. Okay. A good practitioner, what we've moved to is full DNA tests now.
Right.
We are doing having a DNA test run on the person, and we're even doing DNA tests on cannabinoids. So any person with cancer should do a full DNA test. We might be treating a person with an alkaline diet and find that we want to treat them with a different diet because they're a different body type.
That is such an important point, because you wouldn't go on a breast cancer drug if you've not done a genetic test to make sure whether the drug will work for you or not, because the chances are that they won't work and then you've taken chemo. So this just makes complete sense.
It's right back to work with a proper practitioner. Really, guys, the man on the street in South Africa doesn't have to buy from the dealer. The networks are so tight. There are hundreds of good oil makers. But yeah, we do train people, and there are a lot of people that are knowledgeable. You don't have to go to the guy down the road because people are being hurt. People are being hurt because they're putting coconut in suppositories and ending up with fatty liver. Absolutely, you've got to work with a practitioner, somebody that's going to diagnose you properly, somebody that's working. I wouldn't touch a cancer patient without an oncologist, for heaven's sake. We do need MRIs, we do need CT scans, we do need all of this information, but we work with the doctor. So if your oil maker doesn't ask you for a medical record, first of all, run your legs off. There's certain questions that we, through the CDIC, are going to we're going to be doing a lot of education through this. So we want people to know what questions to ask. So
in 3 weeks' time, or whenever this video goes out, as soon as we know we legally allowed to have cannabis at home, you guys can contact me and I'll refer you.
Fabulous.
Because you don't want your number on any
no,
link
absolutely
right now,
not. But we have a database.
It is legal still, guys.
Yeah. We have a beautiful database, though, Delene. We have been putting networks together. So I would give you a list of a group of doctors that are prescribing the oil.
Fantastic. That's so helpful.
And you then refer your patients to there.
Because we will have a lot of viewers calling in wanting to be referred. And I'm not going to do it until it's legal.
I absolutely. Well, I understand.
I can't go to jail.
I can't say the same, unfortunately. But yes, the whole world wants this product. It's taken the world by storm.
No, it has.
And it's just legal in so many places.
The difference between hemp and cannabis, because there's a lot of confusion out there. People think that they can medicinally treat their condition with the hemp oil that they can buy off the shelves.
Oh, I'm so glad you asked that question, Delene. It's a really important question. What's happening at the moment is people don't understand the difference. So the hemp plant and the medicinal cannabis plant are two different plants actually. Literally, hemp is generally the male plant. What constitutes a hemp plant is a THC count of 0.37. I think that's the figure.
Right.
So minimal THC.
So you cannot get high from a hemp plant.
There's no high from a hemp plant. But to unlock CBD scientifically in the lab, you must have THC. So the amount of CBDs you unlock are relevant to the amount of THC you have in the original plant. So hemp
So
is
you're
not...
saying unlocking the cannabinoids?
Yes.
Right.
So a hemp plant with minimal THC gives you minimal CBD. So guys are rushing into the health shops and buying products that they feel is going to cure their cancer. I'm afraid hemp is not going to cure cancer. Hemp is a food supplement. It's a marvelous product. Beautiful houses built out of hemp. Incredible furniture. A lot of the top new motor cars are hemp today. Bodies. It's just incredible what they're using hemp for. But please, guys, it's a food supplement, or it's a motor car, or it's a table or chair.
Sure. It's not a cancer cure.
It's not a cancer.
Or something for epilepsy, which is something else we haven't touched on.
Absolutely
is
not.
the phenomenal results with epileptic patients, especially children with fits.
It's incredible, Gillian. We've seen children stop seizures in 13 seconds again. Literally. We've
oral
seen
administration.
oral administration, tiny doses. We've seen children with brain damage walk in 5 weeks.
Wow.
A child that hasn't walked for 2 years, that doesn't recognize his parents, 5 weeks later, this child is talking, is communicating, not talking, communicating with his parents, but he's up and walking, playing, swimming, riding his bicycle. The stuff that you see, the tinctures are incredible, actually, really, for neurological things.
There's just so much hope. Finally,
At last.
there's so much hope.
Yeah. At last, now that the truth is out the bag.
We had a lot of fun today and we learned so much, and I really appreciate your time and thank you for sharing your knowledge and your passion with the world.
Thank you so much for having me. It was a pleasure.